Good morning and welcome again to the latest in this elephant series on COVID-19 and its impact around Africa and around the world. And today it's a great honor to have my friend, Dr. Godwin Murunga, with us. Dr. Murunga is the 7th Executive Secretary of the Council for the Development of Social Science Research in Africa, based in Dakar, Senegal. He is also a Senior Research Fellow at the Institute for Development Studies at the University of Nairobi, from where he's on sabbatical as he serves as the Executive Secretary of Codesria. He is the founding Deputy Director of the African Leadership Center, which is a collaboration between King's College, University of London, and the University of Nairobi that is based here in Nairobi. Godwin is a historian, did his first and second degrees at the Kenyatta University, and his PhD at Northwestern University in Illinois. Karibu, Godwin.
Asante sana. Thank you very much.
It's, we're grateful to be able to catch you while you are in Nairobi, but I wanted to ask, how are you doing? I mean, and how are things in Senegal? I know you're currently marooned here, but I'm sure you're still working. Technology has allowed to continue work. But how are you doing? How's your family? And how is lockdown treating you?
No, we are actually very fine and adjusting to a new work environment. Incidentally, John, I was actually on my way to a meeting, both in Malawi, South Africa, and Mauritius. When I got to Nairobi and found out that I could no longer head to Lilongwe, because the meeting had been cancelled as the pandemic was beginning to gain steam on the continent. And so I am here, but really had not prepared to be here for this long. And you are right, with the advantages of technology, we continue to run the affairs of Codesria, even though all the staff in Dakar are working from home. We are alternating, those ones who are in Dakar alternating different days to come in the office, so that in case there is any danger, you break the cycle of contagion by making sure that only a limited number of staff doing essential things come to the office. But so far, I would say the activities of the council have continued, at least those ones that don't need travel, and those ones that don't call for big meetings are continuing as had been planned. Yeah.
Great, thank you. We're into the second month of lockdown, ending in a few days. Will be two full months where really people have not been moving and the physical distancing has been in place. And I wanted to ask, what does the pandemic portend for the African Academy? What developments have you seen so far? One of the things that has struck me is that even for us now at the Elephant, of which you're one of the founders, I forgot to mention, we've spent quite a bit of time looking for academics, looking for our experts, for our intellectuals, and that's happening across the continent. All of a sudden, a group which had been marginalized, alienated from the center, suddenly we want our thinkers back in play. And I just wanted to ask, what this means, what the implications are of this, and is this does this present, in that sense, does Corona present an opportunity for the academy, for intellectuals and thinkers like yourself to be more central to informing the debates and narratives that come out and some of the solutions that we need to imagine for ourselves now.
John, you will know for sure that even under normal circumstances, in Africa, it is difficult to be an African academic, based in Africa primarily, but also based anywhere in the world. This is because the mainstream Western knowledge-producing institutions have historically never really given that much attention to knowledge producers in Africa. But also, even under normal circumstances, African governments have been a lot more reluctant to engage academics within their own countries, within the continent. Chronic underfunding of institutions of research, limited availability of basic things that you need in order to conduct research, in order to write, in order to inform communities of policy. Actually, a rather deafening silence from policy actors where they need to get lessons from African academics. It used, the late Professor Tandika Mkandawire had this very interesting line where he used to say that it was easier for an expatriate to come into Africa, tell African policymakers as part of consultancy or part of policy advice, things that we in Africa talk about in our common rooms and in restaurants and in bars. So the point is that under normal circumstances, it's been difficult for African academics. I think that some of the basic challenges that affect African academics will persist. I think it's going to have implications for funding. The infrastructure for research is still bad and might grow us in the coming days. But of all this, I think the biggest opportunity has been that African governments, African institutions of learning have been reminded that they have been sitting on a resource in terms of the knowledge, in terms of the skill, in terms of policy advice. They have been sitting on it without really doing enough to consult and deal with it. And I say this only because all the models, well, maybe let me not take there, most of the modeling that has happened around corona pandemic, be it in Europe or in the US, has fallen short of really providing a comparatively accurate picture of how the pandemic is panning out. It took China at least a month for them to begin to figure out what was happening. And think about the amount of investments the Chinese make in research. The US has been a disaster of sorts because they have a political establishment that distrusts research and facts. Yes. And the researchers on one hand are saying one thing, the political establishment is saying something. The federal government has no unified structure of information that would be useful. And all while they are having all these problems in the US, in Europe, there has been a generalized assumption that perhaps where people need to make definite statements about the way the COVID pandemic is going around is in Africa. And so while more people are dying in Europe and in the US, a good many commentators in Europe and US are warning us about Africa. And as we speak right now, much of what they have said has not really happened the way they said.
Correct.
And where I'm saying there is an opportunity because there is a totally different logic to how Africa is working in the context of the pandemic. And having watched a number of videos that, recordings that the Elephant has done, and having watched several media on the continent, it's clear that in Africa we have and we need to encourage a different analysis. And this is the opportunity you are talking about. African academics are reflecting on the local experiences of communities in different countries, and being able, therefore, to guide both at the level of intervention, but at the level of policy, guiding on where we really need to be thinking about. John, what would surprise you, maybe won't surprise you, is that this opportunity has always been there. It has always been there. When I was at the African Leadership Center, we worked with colleagues to produce a book on the Ebola epidemic. Okay. And actually, 14th General Assembly of CODESRIA in 2015, there was a panel on Ebola epidemic, but contextualized within the broad frameworks of analysis of public health and medicine. And a lot of this information has been lying around without being utilized. So I definitely agree with you that the opportunity to make visible forms of knowledge that have been invisible is perhaps the greatest opportunity we have witnessed with the emergence of the pandemic we are dealing with.
When we were speaking earlier, you shared a bit of an insight, which I would like you to sort of perhaps discuss in greater detail, which is the impact, what the COVID-19 pandemic has told us, or shown us, demonstrated to us in terms of relations between the state and non-state actors in the whole area of public health. And I'll be grateful for your comments on that. What lessons have been learned and what opportunities lie ahead?
So really, to begin to think about the state and non-state actors in the context of the lessons of the pandemic, one has to remember that in the 1960s, one of the biggest gain out of independence of many African countries was the level at which the state was able to invest in sectors of society that colonialism had denied them. Education, infrastructure generally, but the health sector. These are areas that had been subjected in most colonies to a racist or a racial logic. You accessed services because of your skin color and things like that. And the African independent governments invested quite a lot in health and in education in particular. If you look at the statistics, they are actually staggering. And then in the late 80s into the early 90s, with the onslaught of the neoliberal agenda, the state, essentially the logic was roll back the state, liberalize and privatize. And so you have especially the health sector and the education sector being hit hard with many of these things, with the state divesting itself out of providing these basic services. In many cases, those of us who do political analysis have forgotten that there are instances where the struggle for multi-party politics was not simply a struggle against an authoritarian state. It was also a struggle against many of the negative consequences that the state was being forced to implement in the context of structural adjustment programs. And the health sector and the education sector in particular were very hard hit. The consequence of this, John, has been that with the pandemic just beginning, you have African countries, a good many of them actually, that do not have a national framework for public health provision. And so what has happened is that external actors come in with the quote unquote funds that they want to invest in the health sector. And their entry point into many of these African countries are actually the governmental organization, not even civil society broadly defined.
Yes.
And the consequence of that is that there are many countries in Africa, I hesitate to mention some, but there are many countries in Africa where the healthcare sector is not organized and run and oversighted by the state. It's basically a whole range of external actors working with non-governmental organizations in the name of providing public health. Now, the consequence of that is that you have a totally distorted system of healthcare provision in a number of countries.
Yes.
And those countries are not, in the context of the pandemic, responding in a coordinated way. As, say, for instance, Ethiopia. No external actor walks into Ethiopia and starts to engage in healthcare provision without going through the state, but also without abiding by their own national policies around healthcare provision. Rwanda is another example that one can point to. And the consequence of this is that you have European countries that are today much more affected by the COVID pandemic.
Yes.
And their capacity to pay attention to foreign countries where they have been supporting specific elements of healthcare, we no longer are priority. Now, any African country listening to this story, that's a big red flag that the only way forward for provision of healthcare is to have a clear national policy for healthcare provision that articulates the priorities of the country based on a clear learning of the situation in those particular countries. A situation where you have European countries in particular, that you need to be focusing on reproductive health, or focusing on population control. A country that doesn't have that problem in the first instance. It really raises specific questions about how the relationship between state and non-state actors has gone on over this time. And I think that's something that as researchers we need to flag so that it becomes clear that not every Tom, Dick, and Harry can walk in with a fistful of dollars and then now we are telling you invest in this, not the other one. It's a really important lesson that this pandemic has taught us. And it has also taught us that the neoliberal framework of provision of basic social welfare needs of people is actually not working. In many of these countries that we are talking about, you gain social capital, you gain legitimacy as a government by even demonstrating that you have basic infrastructure for community health, for instance.
Yes, I would like to think that African states will realize that they need to change their strategic approach with regard to public health, that they cannot actually leave this to external actors. Otherwise, we are caught literally with our pants down when this kind of challenge arises. But Godwin, you're a historian, an African historian, and people have been looking for historians. I've even been watching talks by medievalists, who because you are able to contextualize. I was speaking to Professor Mohammed Bakari, who Mohammed Bakari was saying, let's not get overexcited. In a sense, not in so many words, saying the pandemics have been here. They're part of the human ecosystem. These viruses are not an unusual thing. They're there. And I was sharing with some colleagues my own view that for quite some time, and more than ever, we human beings have been the planet's apex predator. And we have grown in power and influence. There's nothing that we cannot tame. Diseases, the weather. We can clear entire forests. We can bomb entire cities to nothing. But a virus has humbled us. At this moment in the 21st century, we are throwing our economies at it, saying, okay, funga economy. We deal with this small, invisible thing that is very tiny. Yeah. What does history tell us about these kinds of moments, Godwin? I mean, this is a huge disruption. The kind of disruptions caused by a pandemic, by war. What lessons does history teach us that that COVID-19 is likely going to, the impact that COVID-19 is likely to have on us, especially as Africans?
Yeah, I mean, one of the things that has disturbed me over the last couple of weeks, John, is the number of invitations I have received to say something intelligible about COVID. I mean, I have numerous invitations, some of which started coming in last month.
Which is a good thing. I feel that
it is a good thing that in the context of a pandemic like this one, where its own nature is such that we do not know nearly enough. It's in the nature of human curiosity to want to find answers.
Yes.
But exactly that is the problem. Because maybe the pandemic is not asking us to find answers. Maybe the pandemic is asking us, take it easy, and first of all, think through what this is all about. Okay?
Yeah.
And maybe it's telling us, ask more questions rather than seeking immediate answers. And I have felt that part of what we have missed are the lessons of history. Okay? More often than not, when you listen to the media, they are asking epidemiologists historical questions. Okay?
Yes.
And we have been quick to do a whole number of things to prevent further spread of the pandemic. Isolate people, put them in quarantine, and just, all these are tried and tested methods.
Yeah.
The pandemic in COVID-19, in my estimation, is just reminding us, and what is the basics? There is no, before COVID-19, the Americans would have told you that their budget for military is there is no country in the world that has a budget for the military comparable to the Americans.
No.
The pandemic is saying that budget is useless.
That's true.
Essentially, that's the message. That a country like South Korea and Singapore, to an extent, are able to find workable ways of managing the spread of the pandemic. It's not because they have a good budget. It's because they, first of all, looked at the historical lessons. Having just dealt with I think it's SARS the other day, South Korea has been able to put in place mechanisms. But it has also raised the question that there comes a time in history when when a public cannot be sorted out cannot be treated as a clinical problem. So you can have the best infrastructure for providing hospitals and all that. This pandemic is saying that the site for the fight against the virus is not in the hospital. The hospital can only be, we were discussing the example of Ecuador, where people have died in such a huge numbers that the hospitals cannot handle it. We saw the experience of Italy, which has a system of medical provision that perhaps is better than many countries. We saw the medical system collapse. So the historical question, if you go, say, to Italy, is this one. How would a country like Cuba be able to design a system of intervention after having suffered years, if you will, of isolation from the mainstream world? How would a country like Cuba be the one sending us out there? And I think that the one thing that the Cubans got that most of us haven't really gotten is that provision of medical service, provision of public healthcare systems is less about what you do in hospitals. It's more about what you do in communities. I think that is the big historical lesson. The big historical lesson is that all previous epidemics, all previous pandemics have been resolved not by investing, by investing in medical provision, but also by investing in communities, because that's where the solution lies. In much of Africa, and one would want to go, say, back to how we began to manage HIV/AIDS, South Africa, Uganda, who are the primary caregivers in those contexts? In contexts where the national budget for health is very limited, in contexts where the most advanced hospitals are private hospitals. I don't want to tell you about the privatization of medical services here in Nairobi, where in the last couple of years, it has been cheaper to send our sick to India than to put them in hospitals here in Nairobi.
You make a very good point. Cuba, which was under sanctions from the US for so long, has suffered many privations and over the past several decades, is exporting doctors in the middle of a pandemic to Europe and to Africa. While we are watching, some of the Western countries have had tremendous difficulty in managing this. And so, you are making the point that, their model is different.
Their model is different because it has prioritized investment in communities. It has prioritized investment in the knowledge that communities have about their own health. Because this assumption that we carry in much of the rest of the world, that we know what the healthcare needs of people are. And so we come from the capital cities and we bring you the knowledge, we bring you the facilities, we bring you the equipment and all this. It's based on a certain level of intellectual, I don't know how to call it, but it's almost like it ignores local knowledge. And what many of the more successful countries have done is that they have believed that communities are better off if they lead the idea of what really they need. And so prioritizing them really is the point I'm saying. And I want to very quickly connect this point to issues of social policy, if you will. Because I think that each time governments are laying out frameworks for social welfare, the welfare of the people, where you prioritize the needs, the healthcare needs of people through institutions that come from the urban into the rural, you actually miss out a huge percentage of what really matters to people. So should the national government, the ministries in capital cities be the ones telling people to wash their hands? What kind of logic is this? Shouldn't they be dealing with more complicated, more sophisticated things? And I think for me, COVID has essentially reminded us that if you trust communities to know and do what they do and do it as best as they can understand, having experienced all these things, they are much better off in doing these basic things. But that we are now using high-level panels, we are now using high-level institutions to do what otherwise are basic healthcare messaging. Is an indictment of the kind of healthcare system we've been nurturing all over all this time. And I think it's time that we went back to reality and understood what we are doing as a country, as a continent.
That feels like an intellectual gauntlet that has been thrown, and I think it's a worthy one, because it's become now a bit of a tired phrase, the new normal, etc. But actually, this is a profound lesson that we've been forced to throw our economies at this crisis, and to lock down very aggressively, which has helped manage things in the first phase, which is, I think Africa has actually done pretty well, because between middle of April and middle of May, we were expecting this catastrophe to happen, but we were able to stop it through fairly draconian measures, which perhaps would not have been. Go ahead.
John, I want to be a little bit cheeky and make the point.
Yes.
Is this the first time that Africans and African governments are actually being able to decide on a major decision almost independently, uninterrupted by others who have always taken the right to tell us what to do?
Correct.
Isn't really the very, very first moment? Some of our presidents are not the most pleasant people. Let us not run away from this particular. But the point is that for the first time, in view of the pandemic, once the rest of the world moved on and started sorting out its own problems, we as Africans were left alone to begin to think about how to sort out our own problems.
Correct.
And yes, cut and paste in some instances, but also let us not run away from the fact that in the process of all these things, African governments, African peoples have been taking decisions, right? And maybe the lesson is this, that we need a lot more of us taking our own decisions, running away with it.
Correct.
The pandemic has given us an opportunity to see how we can go. So I can stand before you today and tell you that Senegal has tried. You can have all the problems you want, but all the news coming out of Senegal is that they have been able to manage that pandemic. Now, people do not really understand what it means in a context of a country that is predominantly Muslim. It has been able to manage its internal religious challenges. It has been able to get the population to accept, to go through these measures without any major incident. They have been able to show that they can manufacture, they can create kits. Testing kits.
Correct.
Affordable.
Yeah.
They have been able to send people home to go and be attended to. So we can focus on the draconian, if you will, but at the heart of these are very interesting lessons for the future. And let me also make a second point. I am not too quick to dismiss Madagascar.
Okay.
I'm not too quick. Don't know the scientific content of what they have discovered, and I'm not saying that I'm endorsing anything, but I'm just saying, having lived in this continent, having seen how basic the initiatives get dismissed because they are African, I'm going to be the last to dismiss until I see the facts on the table. And that's the point that we are saying. The point we are saying is that really, given a sense of autonomy to do our own thing in the context of the pandemic, acknowledging that it started in many other places and only reached us late in the day, the Africa that has consistently been dismissed as being capable of even picking up one lesson and doing its own thing is beginning to show that the modeling, the curve that had been projected isn't working. The UNECA had projected, according to the document I saw, had projected that between 300,000 and 3.3 million people would die in Africa. That, to be honest with you, is the worst kind of prediction that anyone can want to use to make policy decisions around dealing with this. So my point is that we have an opportunity as Africans to show, and I hope that going forward we'll be able to demonstrate that we are capable of learning and doing our things. And as everybody is focusing on their own countries, the Europeans are focusing on their own situation, the Americans are focusing on their own situation. Maybe the opportunity is that we can also do our thing. And the research community, I must conclude, is available to speak to some of these things.
Thanks, Godwin. Just related question. The last General Assembly of CODESRIA, the theme was globalization and its impact on Africa. That's a lot. What has COVID-19, the disruption to globalization? First of all, there's a sense in which this pandemic has been accelerated by globalization, and the economic impact has been accelerated profoundly because supply chains have been disrupted, in terms of our ability to trade. We now cannot fly around the world the way we used to. And what are some of the lessons, some of the immediate sort of ideas that have come to mind, going from the fact that you were discussing globalization at CODESRIA last year, and here we have this virus has come as a major disruptor.
Yes.
To the market.
Indeed, you are right that the theme of the last General Assembly of CODESRIA held in December 2018 was Africa and the crisis of globalization. And I recall that when we were discussing the choice of theme in Pretoria in December 2017, the executive committee of CODESRIA had this long session where we were unsure how to frame the topic. There was a proposal, Africa and the challenges of globalization. There was even an argument, I can't remember how it was framed, but somebody made the point that maybe we need a more neutral topic because the proposed topic of Africa and the crisis of globalization was not neutral enough as to allow for us to investigate the many-sidedness of the issue of globalization. And at the end of the day, we took a deliberate decision to really do the General Assembly on Africa and the crisis of globalization. And guess what? Doesn't the pandemic suggest that there is a real serious crisis of globalization?
Correct.
Think about it. While here in Kenya, for instance, people were complaining about the virus coming in from China, they forgot that there are other alternative paths through which the virus would get into this country, right? We had this anti-Chinese sentiment. The landing of the China Southern flight caused quite a bit of problems. We did not remember that once the virus took flight from China and got into Europe, given our connection to Europe, because of globalization, because of the instance of colonialism, that we were more exposed comparatively. We were more exposed with the danger of COVID-19 coming from Europe than coming from
China.
And that speaks to the complexity that globalization presents in the context of the virus. New York, the virus in New York is a specifically European import. I know of people who traveled from the US to the UK to Nairobi, okay, and the virus was not tracked at all until you got into Nairobi. So the point I'm making is this. You know, as a historian, I once wrote a chapter titled "Inherently Unhygienic Races." That's of my paper, which I published a while ago. And I found that phrase in the Colonial Archive, in one of the medical officers of health.
Yeah.
Basically made the argument that we needed to segregate people in Nairobi because there are some races that are inherently unhygienic. And when I started tracking the data, and I'm really talking about Nairobi between 1892 to 1907.
Yeah.
I started tracking the data. I found that the vectors around which bubonic plague spread in early colonial Nairobi had very little to do with inherently unhygienic races. It had everything to do with anything else, the structure of Nairobi and the way it was being managed and all that, and nothing to do with inherently unhygienic races. I'm using that example to remind everyone that the challenges of globalization are such that the basic assumptions we have about different people, the basic assumptions we have about movements of people and goods do not always hold. Globalization represents what somebody called time-space compression.
Yes.
Right? It has opportunities in it. It has dilemmas in it. It has dangers in it. But at the end of the day, in the context of the current COVID pandemic, essentially globalization has turned out some of the key things we identify as important for facilitating globalization have become our biggest problem. So the virus has spread more through, initially through the flights than anything else. I mean, we can talk about community spread and all that, but initially this has spread through, so forcing us to ground almost all the aeroplanes that one can think about that move people. Now there are a few that are moving goods, but we've grounded all of them. Airlines are going to have to declare bankruptcy. Okay, this whole idea of this whole nativist idea that has taken hold in Europe and the US will very soon become a self-fulfilling prophecy, where you wanted to kick away the immigrants. Well, they can't come anymore, right? And the consequence of that is that there is a huge smack in the face of proponents of globalization, seen in terms of technology, seen in terms of closer proximity of people and all that. I think this is the big crisis that we are going to have to deal with. And worst of all, especially if it begins to dismiss the state as an important player in many of the things that we do as human beings.
If you are asked to imagine states learning the lessons that they should from this pandemic, as a final question, what measures, what policies would they be looking to implement, to be able to deal with this kind of eventuality in the future? Because, the fastest ever vaccine produced was for the mumps. That took 4 years. This one, they're saying maybe in 18 months, we might have something. They might have some treatments in before that. But from all you've said, Godwin, is that, this is not a clinical problem, first and foremost. Number two, it causes questions in terms of the relationship between state and non-state actors in public health and the role of community. So these are pretty big chunks of the kind of strategies that states have to deploy in terms of then, in terms of delivering services to their people. And so, perhaps can we close with what would you hope would be some of the most important lessons and changes that would emerge out of out of this experience. Number one, for the academy. Number two, for the way we manage public health, and also in terms of leadership, Godwin. I mean, we've seen some, I think, some pretty impressive leadership from the front out of South Africa. You know, President Ramaphosa seemed to be in political sort of uncertainties until COVID arrived, and he has really risen to the challenge. We've seen probably President Museveni of Uganda, who before that was really portrayed as this old, tired dictator. But again, with regard to COVID, his response has been impressive. Same thing with Ghana and Senegal. The stories are beginning to emerge. Africans are manufacturing their own masks, their own PPEs. There are even people who are building ventilators. So, what would be some of the lessons that you say, okay, that if we don't learn, we shall pay a high price for, if you're looking back?
Yeah, John. One of the key lessons that I think is sitting right before our eyes is not isolate matters public health and treat them as if they are a separate thing, disconnected from everything else. I think that's the biggest lesson.
Yeah.
I was listening to I think it's the Minister of Health of Singapore.
Yes.
And he said the success of an intervention is going to depend on three things. It's going to depend on the quality of the public health system, the quality of healthcare. So you're talking about, the hospitals, the capacity of medical staff to intervene at the level of, their training. All that system is like very important. So we don't want to be dismissive of it. But he also said it's going to depend on the nature of the governance system, the capacity of a state to mobilize itself to intervene in this pandemic. And the third one, which I don't think we pay too much attention to, he called it social capital.
Yes.
The capacity of a state to take action,
yes,
but to have people buying into it, and therefore the state being able to use social capital that it has amassed over a period of time. In other words, people don't simply reject the interventions of the state, draconian as some may be, because they are draconian. They reject because there is no proven capacity of the leadership to demonstrate achievement before the pandemic hit. And there's a young student from Uganda whom we trained at the African Leadership Center, who wrote a nice brief note and said, success with the pandemic is not going to be dependent exclusively on what we do after the pandemic.
Correct.
It's going to depend on what we did before the pandemic.
That's very well put.
This is really correct, because I think if there is any big lesson to be picked out of this, it's precisely that the infrastructure we put in place is absolutely important. So I would like us to move away from the days when we thought diseases are handled in hospitals and clinics, to days when we understood that what you do in communities is important. And this, John, I should say, links up very quickly with the question of funding.
Yes.
Any governments that are going to continue investing more in defense, for instance, and less in public health, the lesson is there for you to see that you can have the best military, you can invest in all the equipment, but we haven't found that one equipment that can shoot the virus.
No.
Okay.
No.
We now are talking about mumps, it was 4 years. We are now talking about 19 months or something for coronavirus. I hope they get it, but really, is that how best to handle this question? Okay. So I think budget-wise, we are being invited to rethink our budgets and budget making processes.
Yes.
Begin to remember that this little thing called a virus, which, by the way, some Kenyans were making fun about, that we have just discovered you don't need a hand sanitizer. You just need the bar.
You just need the
virus.
you just need what?
How? Yes. Yes, John.
Sorry, no, I didn't hear you. You said you don't need the sanitizer. You just need a
bar soap, the one that we use for washing hands and washing clothes. Okay. Actually, the cheaper version of it is more effective in fighting this. And it takes about 15, 20 seconds of washing your hands consistently. And you are comparatively safer than all these amounts of money that we are putting into it now. So the big budgetary question, I think, has come back to the table. Of course, I had already mentioned that investing in the real caregivers is going to be important. This should be organized by the state rather than by non-state actors. I'm not saying that we do not need non-state actors, but I think a coherent framework is perhaps more important. I think the third point that has emerged with specific reference to Africa is that we need to reconnect to our academic communities in ways perhaps that we have underappreciated previously. A lot of the good information that helped fight Ebola in DRC, in the Mano River Basin, was local knowledge. Again, people don't remember this very much. We first began to deal with Ebola by parachuting in medical doctors from abroad, only to realize that how you deal with the dead was more consequential to dealing with Ebola than how much medicine you administer. Okay, we haven't said enough about doctors in the Congo, okay, who have pioneered approaches to dealing with this disease. So reconnecting with our own communities. But also in the context of that discussion, a bigger lesson, which I hope comes out even from the series of interviews you are conducting for the elephant, is that it's one thing to make an argument that you want to invest in science, biological science, physical, and all that. But the situation becomes totally when you begin to appreciate the fact that a lot of the challenges we face around public health are social. So those governments that are waking up to say we need to stop funding history, teaching history and all this, and we spend money in chemistry and all this, you cannot control a pandemic outside the laboratory. That's just as simple as it should be.
Correct.
I've seen many leaders make that mistake, and I think the lessons are now at home. So I hope those are a useful guide.
Dr. Godwin Murunga, asante sana for those very profound insights that give us a lot of food for thought. I'm sure that we'll be coming back to you because this is something that is developing fairly quickly. And I didn't have a chance to interrogate you a bit further about just the leadership across Africa and the implications for how leaders now need to act and behave in a post in a reality. I was interviewing Professor Larry Diamond of Stanford, and he made an interesting point. He said, "Well, we've been talking of China as a rising power, and now we have to accept it has risen." That's the idea of China as a coming superpower is finished. China is a superpower now, and that's a reality that we are going to have to deal with and manage.
Yeah. No, thank you very much, John. Appreciate the occasion to discuss this, and wish you all the very best.
You too. Thanks a lot, Dr. Godwin.